Welcome to the Bioptimizers Awesome Health Podcast. And now here's your host, Wade T. Lightheart.
What if you could double your energy naturally without caffeine or stimulants in just 3 short months? It's not only possible, you can transform every aspect of your health if you follow the 12-week blueprint we've created for you in the Awesome Health System. The Awesome Health System is a free course where you receive a daily video lesson spanning the most cutting-edge secrets for air, water, exercise, sunshine, optimizers, mindset, and education. It's something most companies would charge hundreds of dollars for, yet you get it for free when you go to bioptimizers.com. To access your course, register to download the PDF report called 3 Phases of Bioptimization, which gets you access to the report and daily access to the first lesson in the 12-week, 84-day Awesome Health course.
Good morning, good afternoon, and good evening. It's Wade T. Lightheart from Bioptimizers with another edition of the Awesome Health Podcast. And today we are going to dive into AI, that is artificial intelligence, and how it is outperforming existing medical tools. In fact, Google unveiled a system that could outperform 6 radiologists in determining whether patients had lung cancer, which causes more deaths, somewhere around 180,000 per year, in the United States than any other cancer. This system also detected 5% more cancers and cut false positives by 11%. We're also going to talk about how AI is stopping the spread of disease. Now, in the early stages of the COVID-19 pandemic, public health officials in South Korea used facial recognition to identify so-called super spreaders, allowing them to quickly track down those who have been infected and thereby slowing the initial spread of the novel virus. As you can imagine, many of these things present a significant amount of controversies and considerations that we have not had to consider as humans, but we are forced into these conversations, and we're going to get into those today. And today's guest is Rama Chellappa, and he is a pioneering researcher and inventor in the fields of artificial intelligence, computer vision, and machine learning. A Bloomberg Distinguished Professor in Electrical, Computer, and Biomedical Engineering. He is also a member of the Johns Hopkins Center for Imaging Science, the Center for Language and Speech Processing, and the Malone Center for Engineering. Rama, welcome to the show.
Thank you, Ed. Thanks for having me on your show.
So, recently I had my first, what I would say, personal experience with AI. I, in fact, told a little story to chatbot GPT, which is a kind of a publicly available AI.
Yeah.
And I asked, I fed a couple of things about me, a couple of friends, my house and things. And I said, write me a song that sounded like Johnny Cash wrote it. And it did. And I was floored. I was like, this kind of sounds like a Johnny Cash song. So now, obviously, we don't need more Johnny Cash songs, but there are some benefits about diagnosis and avoiding misdiagnosis in the treatment of disease. And I think that's an area that you focus on. So maybe you can share with people a little bit about your background of how you got into AI and its applications from a medical side.
Sure. I took my first AI course in spring 1978 at Purdue.
Wow.
I was a PhD student. And since then, I've taken many courses on that. And I've been an AI researcher, computer vision researcher, and so on. And computer vision is an application of AI. What Tesla does, for example, all the cameras, and then it tells you where the other cars are. And it tells you if you're going to hit the car in front of you and things like that. So that's an example of computer vision, but there are a lot of other examples. So I have been doing this stuff for almost 40 years.
Wow.
And AI has had its ups and downs. It's almost like a human, we have our ups and downs. So
yes.
In the 70s, people who practiced AI overpromised and underdelivered. So that always is the issue with AI, because everybody is so excited. We see all these Hollywood movies and so on. Of course, some of them portray AI in a kind of scary way, but nevertheless, the whole idea that there could be an intelligent computer next to us is very exciting. So people expect all sorts of things, and it sometimes doesn't deliver. So in the mid 70s to late 70s, it had what we call as AI winter, and then it's now back again. And of course, ChatGPT, as you say, I mean, everybody is talking about it. Millions and millions of people get on it. In fact, my student put my name and say, "Hey, who is this guy?" And it kind of got most things right, including my recent election to the National Academy of Engineering and so on. But it also made some stuff up. It said I have received a Guggenheim Fellowship. That's not true. So, and for somebody's question, it said there are 4 female US presidents. That's not true. So what I worry, the Johnny Cash song is okay. It's somewhat harmless. Okay, so it's not exactly Johnny Cash. Let's say it's somebody else's song. You say, yeah, but it looks good, because when you do it, you get back something, there is no real reference. Even Johnny Cash himself may have some variations, right? Not every song of him, because I've seen this movie many times. The Johnny Cash movie that comes in TV. I forget, can you Walk the Mile?
Walk the line.
Yeah, I've seen it. I like to watch movies with music as a thing, and I like that. So I like blues.
The John C. Reilly comedy version was really funny. If you have to watch both.
That I have not seen. I should see it.
That's great.
So there it's not that consequential. But if I don't know what the real thing is, and if chatbot gives me something that's really made up stuff, it's not good, right? Because none of us want to be given things that are made up. I mean, then you won't trust your friend. If your friend, you have a friend, and the friend kind of makes up stuff, even 10% of the time, then you start wondering, when is this person telling you the truth? When this person making? So integrity. AI with integrity is what we need. In fact, I'm reading even more disturbing news about Bing bot, that it says nasty things and threatens people and things like that. You don't want that. AI can do good things, like the example you pointed out, Google, medicine paper, Nature medicine paper on lung cancer. They have some papers on diagnosing eye diseases. And I personally resonate to those things, because we are actually working on those problems at Hopkins, So I think those are good things, and we need to push them. And again, another thing I will say is that there's always this question of AI better than human. Like, in your opening remark, you said it's, better than radiologists. I want AI plus radiologists, because that actually produces better results. So I know when we write papers, we like to, I've, done work on face recognition, right? So there are people who actually do that as a profession, forensic examiners, right? For example. So people asked us, how does your algorithm compare to what a very experienced person does? So we have an experiment, and then we give same images to the AI algorithm that we developed and to the person, and see how we do. One of our algorithms was performing at the level of an experienced forensic examiner, not all, just one. Then we said, okay, why don't we combine the best decision and fuse the decision, then the performance is good. So what I'm telling folks is that, it's kind of nice to say, because everybody wants to know whether your machine can match the performance of human. That's a natural question anytime you do that. And of course, then the natural question comes, oh, can you replace radiologists? I said, no, you don't. So, but fusion is where I'm looking at, because, you cannot do anything in AI in medicine without doctors, right? If you go and sit in front of a box, it looks at you, okay, wait, you need to go into OR now because I think your heart is not working well. You say, hey, wait. I want to talk to an MD. So I think, AI with integrity, it is there in many applications, and the new developments like ChatGPT and Bing bot make me a little worried, because it has this issue, stuff, making stuff up.
Right. So I guess that's I guess maybe the first question we can start with, particular around people's apprehension about AI, is how do you extricate, as someone who develops AI, the natural human biases that may occur in the program? I'm sure that's a big issue. How do you account for that, or how do you program out of it? And considering you've been in this field for so long, what developments have you seen along that to kind of manage the inherent biases that are going to come into a program?
Very, very good question. 2018, it's a report from MIT that did some experiments. They took 3 commercially available face recognition systems and applied them for gender classification between 2 groups of people. One group is light-skinned males and females, parliamentarians from Norway. Other group is faces of dark-skinned males and females, mostly newscasters, politicians, etc., from African countries. And then they showed, oh my goodness, it's not working that great for dark-skinned males and females, and it caused serious concerns. And one of the algorithms that was tested was Amazon recognition. And Amazon then went and fixed it. They did some improvements to the algorithm and brought down the error rate considerably. And then it also turns out the one thing that confused the AI is the fact that the hairstyles of both groups very close, very similar, like close cut, because the parliamentarians in Norway, being conservatives, they didn't have the hippie style thing. And the African males and females who were professionals, politicians and newscasters and so forth, they were also, very close haircut. So, but then when first people don't, go deep and find out, this was work done by one of my friends at Caltech, Professor Pietro Perona. So hair style is also important, and so that the AI can get confused. But then people may, oh my God, it must be the skin tone, it must be the gender, right? Now, coming to your question, we have built face recognition systems, so we were concerned if it has any bias, but we have a method for probing into deep networks. See, deep networks learning, everybody calls it black box, which is true, right? You feed input, you just give your face, it says this is very light heart. And you don't know why it said that, how it said that. Explainability has been an issue, although we're making some progress in it. So we go in, like Ross Perot used to say, let's look under the hood.
Right.
You remember that?
I do.
I'm dating myself. That's fine.
I used to watch those Ross Perot pictures
SNL
on Sunday nights with a friend of mine who ended up being a physicist at the Gottlieb Space Center in Maryland, and we used to watch the Ross Perot. You get up with a piece of paper, call this number. He was a very interesting character, real maverick.
Yeah,
actually had a big impact on the election back in the day.
Yeah.
So,
Anyway,
so they're looking under the hood like Ross Perot.
Yeah, yes. If you do that, then you can kind of see that even our network was doing better for males compared to females, and it had issues. So we went and we fixed it. We introduced new kind of training methods known as adversarial training methods, knowledge distillation methods, and so on, and showed that you can reduce the bias. So it doesn't go to zero. What happens, Wade, is there is a trade-off between bias and performance sometimes. It may not be it may be totally unbiased, but what if it is only 30% accurate? Then you may say, who wants to deploy that because it's making a lot of mistakes, right? So, but then nobody knows how much bias is acceptable. Somebody will say you should not have any bias. So that is still being, discussed and so on. I feel that we should not introduce a technology that knowingly it doesn't work for all people in this society. So we should try our very best. So what is the option? We tell people, wait a minute, when it makes a decision, be careful. It may be biased, so you got to exercise, your own judgment, how much of that you should take, combine your judgment. So human AI interaction, that's so important since AI is not perfect. So,
which brings up I guess another question. So you've been in the field for a significant long period of time, and that provides you a unique advantage in understanding how quickly this technology can scale. So one of the issues that people talk about is the cost and computing power required for AI is a limiting effect. And then we have the Ray Kurzweil, the Kurzweil analysis that says, okay, we're going to go to the singularity. I literally had a woman here who was using it's kind of a 3D technology headset that you win, which was an AI, like was a generated world that you entered into. And I could feel my sensory input leave this plane and move into that one. And so that I was not aware of my physicality. I was aware of the sensory stimulus that was going on. And I asked her, how do we know when we become the singularity? And she says, well, we won't. And now I'm a novice and I don't understand all of these things. And so one of the fears, I guess, that comes up is as the cost of computing power goes down and the proliferation of AI goes forth, where's the role for humans in that equation? And do you feel we're going to end that in that direction by 2030, as Kurzweil suggests?
No, because I know AI is not perfect. And AI will continue to make mistakes. AI lacks common sense reasoning. There is a very nice article I recently read in the Harvard Gazette by Steve Pinker. He's a professor in psychology and so on. And he says, if you tell chatbot, okay, I got up at 9 a.m., and then I went to bed at 10 p.m. So what was I doing? Like I say, 2 p.m. I mean, because the 2 p.m. is in between these two. So chat say, yeah, maybe you were just sitting around or drinking coffee or eating. This is, well, you didn't provide any information about what you were doing at 2 p.m. I don't think you were there at 2 p.m. So it gets all confused, right? So all I'm saying is, I think the notion of singularity is talked about. It's like general AI. We now have specific data-driven AI, domain-driven AI. Will the computer become general AI? I agree with what Professor Pinker says. Common sense reasoning is lacking in AI.
Could you explain the difference between specific AI versus general AI? Because it seems you're working specifically on specific AI. In other words, you're taking a set of data sets, you're plugging that in, you're trying to screen out for, let's say, medical screening. That would be a specific application. How does that differ from, say, a general AI, which is where I think that's where the fear seems to emerge? Right?
General AI is just being intelligent, like, for example, if you go to a McDonald's in Japan, you're not going to be so confused. They may even have Japanese things and so forth, but you kind of know what you order and so forth. You say, give me that. That's why they have these pictures of various food if you go to Japan and so on. But if you send a robot there, it might still be able to do it, but it'll also get confused by what are all these characters here? I don't know where I am. Maybe it'll look at the big M and it'll say, yeah, I'm in McDonald's. So that gap, the common sense reasoning, you won't be so taken off your stride, so to speak, because you are in a new place, or you see some new people, or you see some new things, and you are able to imagine, extrapolate, and so forth. So more and more we are looking at, can we give more synthetic stuff, the stuff that you said, the synthetic world, to make the AI better and better, because if you just give AI the data it has collected, for example, MRI image, that has happened. That's it, right? But there is no imagination, all other possible things that could happen. So synthetic data is being thought of as one way to make the AI better, but still, general intelligence is what humans have. Mm-hmm. We are able to get up, and if it's a different day, we are able to, you're not programmed. You have a general idea of certain ways things have to work logically and physically and emotionally and so on, and you string those. That's all your software packages that you have, right? And so you are able to pull them together to address a problem. And the kind of problems that you do, we take care of so many things in a day. I mean, you can't even count them sometimes, right?
Of course.
But every one of those things, you need some kind of an AI. And, it's like can you ask infinitely specialized AI will be a general AI? I think, that's a very interesting question. So general AI is different in the sense, specific AI, we understand. I'm trying to recognize your face. That's it. I won't do anything else. And general AI, I should be able to, figure out your face, your expressions, and then, understand your mood swings when I talk to you, and continuously, being aware of what is happening. I mean, that is the general AI intelligence as we understand. And it may not be just done by stringing together thousands of specific AI. I doubt that there will be gaps. There are always things that we don't anticipate. For example, I like to say AI doesn't like surprises. Okay. Humans, we kind of may not like it, but at least there is some way we kind of, interact or protect ourselves or kind of do it. AI doesn't have it. Where does it get it? It can only, based on what we do these days, it can only understand what has been given to it. So sometimes we say, a 2-year-old, you show a mug, and then, hey, this is a mug. It says, okay, how many samples of mug we have to show to a 2-year-old? Just a few, maybe with funny shaped, coffee mugs and so forth. And then you put it on the floor and put a towel over it. So where is the mug? What does the 2-year-old do?
Lifts the towel.
Yeah. No, you have to write a program for that, for mug, for everything. So everything has to be scripted for AI, but for humans, you can make that. If you ask a 2-year-old, where is the belly button for a tree? It'll kind of show in the bottom 1/3 of the tree. That's where the belly button is. It doesn't know that the tree has those sorts of common sense extrapolation. That is what we have.
So it's extrapolation. So humans have an ability to maybe, one of the things that I think that we traditionally do is anthropomorphize, that is the projection of human characteristics onto non-human things. And that's what you're kind of talking about there, is where, well, if the tree was a human, the belly button would be here. We do that in the development of gods, of religion. And, when I was reading, I think it was Yuval Harari's book. He wrote Sapiens and then Homo Deus and 21 Lessons of the 21st Century. And he was talking about the replacement factor of AI technology, or of how it will create massive disbursement, but he said the freeing up of mankind so that we essentially become the gods was the kind of the premise of his books. And of course, there's a lot of controversy within that. But how do you see the future with this technology? Maybe from a specific standpoint. We'll start with the specifics, which is where do you see AI as it is now, and how it can improve human quality of life in these kind of specific systems?
Oh, yeah. I think we have a 5-year program at Hopkins. It's funded by National Institute of Aging. I work with gerontologists and geriatric physicians. Healthy aging, AI technology for healthy aging. We have wearable sensors we can put on people. We can also have instrumented sensors. When they come to a clinic, we can continuously monitor their health. And then, sometimes seniors, they just forget to take their medications. Just telling them to get up and walk around or take medications, or if they have a tendency to fall, all these sensors are available. So what AI can do, not only for elderly, for all of us, it can mine data for my health data available from the time I'm 3 months old, right from the immunization thing to vaccination things, and constantly looking for gaps. See, when I go to my doctor, I see my doctor once in 6 months. He doesn't remember what we talked about the previous visit because he has lots of other patients. So what does he do? He takes a big folder. He still has the big folder. No, okay, we talked about this last time. So he takes some notes here and there, and then we discuss and so forth. But if there is an AI that's personalized for me, it will know what my blood report was last time, and it will know what it is now, and it will kind of analyze the trend and kind of predict, is there anything we have to worry about? And it may help the doctor. Maybe you want to find out why triglycerides went up for Chellappa this time by 30 points. They was eating too much fried foods. Those are reasonable questions that And AI can ask, and it can remind the doctor. These are things we talked about. So we have at Hopkins a platform known as PMAP, Precision Medicine Analytic Platform, where you can store all the data in a very secure way and do inference on it, machine learning on it. And it can store electronic health records, it can store diagnostic images, and I hope it will also store conversations between the doctor and the patient. And then it can continue to watch over you. It's like sitting next to you and, invisible agent watching you. And then if there is any deviations, abnormalities, anomalies, it can raise a flag, and then the physician gets involved and says, because the physician, they can remember a few things about you. They know you have been doing well, etc., but they don't remember all the, for example, motion-related disorders. If I develop, that's one indication for frailty. My doctor may not remember that when he saw me a year before, that I was slowly starting to walk slowly or limping and, things like that. And now it may be a little bit more pronounced, but to have a quantitative measurement, a motion sensor can be useful. So AI can be programmed to provide a personal health thing. In fact, you can even do simple things like what you ate. Take a picture of, let's say you ate, today oatmeal and had, fruits and this and that. It'll take a picture, it'll analyze and tell you how much calories this, and then maybe afternoon, you can. So, in fact, in 2015, I had a high school student who wanted to do a project with me. I told him, go to McDonald's, order some food, take a picture, and calculate the calorie and create an app. So he'll do a big Coke, big fries, small this, and then, there are information available. So, in any number of ways, these sorts of data-driven inference things can work. I think personalized healthcare.
So what are some areas that you've noticed already where AI is improving outcomes for patients?
I think diabetic retinopathy is a great example. Google Brain actually did it years ago. And one of my colleagues in computer science at Hopkins has developed a method for sepsis detection. And that's sometimes, it's a very subtle thing and becomes very difficult even for doctors. And it's being used in hospitals, so that and there are methods available for monitoring delirium situation. People have worked on, I don't know if this has been implemented yet, at least it's there in the research. An anesthesiologist, wants to know, is there any chance that the patient can go into low blood pressure situation, and they don't want that. So there are all these things happening now. I think FDA has approved more than 140 such things, various things that can be done. The interesting thing is, I want to know, when you go to a place, suppose there are video cameras, right? You have a note saying, hey, there is a video here being taken of you. I think you will see, I don't know if you have seen that in some places when you go to let's say a mall or an office building.
It's pretty proliferate. Like, for example, when I went to Dubai recently, the entire road, all the roadways have AI. They issue speeding tickets or violations. It's all an automated way of doing that.
The question is, have you seen a little sticker saying there is a video camera in operation?
Yes.
Some places have. I want to know, when a doctor is comfortable in having in his or her room, AI is here. Right? It's going to hopefully happen more and more. And then it opens up a lot of interesting conversations between the patient and the doctor, because, the utility of AI, chatbot GPT is more, I kind of see this. I appreciate that. It's really a technical advance, but it has become a bit of a distraction. Everybody is kind of, saying, oh, it says this, it says that, and so forth. But there are real systems based on AI that are being used, like the sepsis and so forth. We need to have more examples of that. And then people see the benefit that AI does, in terms of providing better care. And then the doctor will be comfortable talking to the patient. You know what? I looked at all your record and so forth. Then I have this little engine sitting next to me in my computer. we fed that and it says this is something we should do and so on. And then it brings into conversation the trustworthiness of the patient with respect to the decisions being made by AI. We trust what our doctors say for most part because we see they went to college, right? MD at Harvard and residency at Hopkins and then fellowship at UCSF. Oh, we say this doctor must be pretty smart, so he knows what he or she is doing. Now, the moment AI comes in to help the doctor, the patient has a right to ask, why do you believe what the AI says? So the question of integrity of AI, explainability of AI, trustworthy of AI, all of that come into picture. So, but we need more evidence of these things working in hospitals.
Right. So essentially, traditionally in the medical industry, when we go to a doctor, there is a general cultural perspective amongst most of the population, not all of the population, most of the population, probably on Pareto's distribution, that this person is an authority on health and is providing me insight from their experience and training to provide me the care or the options that might be best for me to live long or recover from an illness. Right. Now, what you're suggesting is now we're going to have AI in specific forms to assist the doctor. Well, then we look down the road. So if we look at where were the early influences of AI into the collective population's consciousness, and I would say, well, we have Space Odyssey, we had HAL, kind of AI goes dark. We have C-3PO in Star Wars, which I was 5 years old. I saw C-3PO. C-3PO is considered, those are kind of two opposing ideas. Like C-3PO is considered a very kind of a benevolent, kind of clumsy, not too bright, but has some specific functions. Or R2-D2, it would be another form of that. He's kind of a mechanic style. And then we have HAL, the bad one. We have also, I think it was iRobot. Which was another dark version of that. And then we have, I think there was a computer-generated medical doctor in one of the Star Trek series, which was an AI-generated character, which treated the patients and had some really unusual anomalies, but was benevolent, essentially. So these are kind of what I call 5 superimposed AI characters, which, depending on your level of exposure and what age, may influence you to think what AI is, what it isn't, how it could influence us. So how do you see AI both fusing with the natural order of authority versus maybe usurping that authority out of superior capability? And then, that we go to the Elon Musk question, which is, does it scale out of proportion? And we're the house cat. Humanity is the house cat for AI. So I know that's a lot, but I wanted to use these models because I think we can't underestimate how they may influence our subconscious in our approach and perception of AI.
Sure. No, I think it's a very valid question. I'm working on a study group for the National Academy of Sciences, and we talk about one of the issues, human-machine interface. And Air Force pilots are very used to having high-tech hardware, software in their cockpit because we're not flying a Wright brothers plane, right? We have F-35. They have evolved over the years, so they're very comfortable because the hardware in the cockpit is very well tested, and sometimes there's hardware failure. It's very well tested. And then the software is very well tested. Now, if they're going to say, hey, now we're going to have an AI there. And then the pilot has seen how AI can make mistakes. And he says, ChatGPT is AI, but it makes stuff up. So is my AI sitting in the cockpit? Is it going to make stuff up? So then there is this tentativeness. Whereas before, I'm going to accept whatever my command says from the sensor reading and this and that. I'm very comfortable. But now this AI, there's a little cloud in my thinking, is it saying the right thing? Or that is something we need to work. So the AI has to become better and better. Now, in terms of all the examples you have said. I saw Star Wars movies, but interestingly, when I saw recently about 5 years ago, they looked so slow. But when I first watched them, they were quite dramatic and so on. I think,
Yes.
our sense of time has changed, right?
Yes,
We
it
now
has.
want everything like that. So that's the first thing I noticed. And they said C3PO was providing comedy in the Star Wars movies.
Yes.
They purposefully made C3PO R2D2, the interactions somewhat a little clumsy and kind of talking. Just they provide because otherwise there was no comedy there. The Darth Vader is coming hissing, and then
Yes.
taking a sword and fighting, and so the comedy, and that's why they purposely made it opposed to hell. The reason is I actually did a show with Gary Whitta. Gary Whitta is the co-writer of the script for the movie Rogue One, the Star Wars story.
Right.
Okay, yeah. And so we had a nice conversation, and then about the robots and this and that, how they were portrayed in Hollywood and so forth. So so he explained to me, in fact, in all Star Wars movies, the doctors were robots; they were not humans. If you go back and see, when
Yes.
somebody broke a limb,
Yeah, absolutely.
it's not a doctor, a robot came and fixed it, right? So yeah, I think. Basically, we have gone through various evolutions of these kinds of characters. I think, AI is an agent, and it's inside a robot, inside your computer, inside your, let's say, smartphone, and so forth. You have to get used to it in terms of how it interacts with you and providing good information and so on. So that is how you kind of overcome the concerns that you have or people normally have by looking at these kinds of movies as potentially what harm it can do and so on. So I think we have to understand Hollywood has been somewhat unfair. I don't know about these things, because I like to say, if you take a movie where a robot is behaving like Mr. Rogers in the Rogers Neighborhood, people will say it's so boring, it's so nice and pleasant.
Right. But Terminator 2, or where
That you
the
can take
AI, is
blast people
annihilating
up.
humans.
Right. So I think we probably need to have some movies where there is Mr. Rogers' neighborhood full of robots and doing, won't you be a friend and things like that. But subconscious is very important. And so you have to work with AI. And that's why the human AI interaction understanding is very important. The other example I can give, let's say Tesla automatic version, right? I mean, we just saw that NHTSA recalled 360,000 Tesla cars because they thought the fully automated one was not behaving as it should. Mm-hmm. And Mr. Musk has his own views on that. I like cars that help me with all the safety features, the blind spot detectors. Yes. And then my car tells me if I'm going to hit the car in front of me, it gives me a signal. And I actually test drove an Infiniti SUV. If you change lanes without giving turn signal, it will bring you back to your lane. Yeah, I said, cool. I
had a similar experience. I was in my Range Rover not that long ago, and I went into it was a little bit rainy, and as a fun thing, I wanted to slide the truck through this particular turn. Now, I have grown up in the winters of Canada, and I'm very familiar with the drift of car, and I'm confident with what I was doing. I didn't feel I was being anything excessive. And then I go into what I perceive as going to be a drift. Suddenly, the steering wheel goes out of my hands. The braking comes on in the car. It put me in a very safe position because it couldn't anticipate what I was doing. From its perspective, I had lost control of the car.
Yes.
I felt I was in control, but it, according to its data set, and maybe it's right, maybe it's not. Of course, it's better to err on the side of caution when you're driving a 6,000-pound car down the road, right?
Yeah, where I was going with my example is that let's assume half the cars on the freeway are Elon Musk's totally automated cars, and the other half cars are like the cars I like to drive. I want to drive it. I enjoy the features, it becomes one hell of a human AI interaction problem. We are driving at 65 miles on the freeways with limited space and lane changes and this and that. The AI cars probably are all connected, so they know where other AI cars are. I may not provide that. Why should I provide that information to Tesla where my car is?
Mm-hmm.
I may jam it, so it won't know where I am. It may just come and hit me. So there are all these things, are very interesting, right? In terms of, so when I see a Tesla now, I have no idea whether it is fully automated or the human has a control. I move away and go to the next lane, and I stay back or 2 lanes back, because that is the fear, the one that you talked
So like
about.
when I see a person driving that seems to be driving errantly, I literally go get into the passing lane and go by them as fast as I can, because I'm like, I can't predict very well what their behavior is going to be. It doesn't seem to be following the regular rules.
Yes. Now, I think that same thing probably can happen with the Tesla with the fully automated version, right? Suddenly, people have said, I don't have a Tesla. People have said it suddenly accelerates or brakes. So subconsciously, when I see a Tesla, I like to move away 2 lanes and then, stay back so I can watch what it does and so on.
Mm-hmm.
So, these are the issues. But I think, like every technology, no technology is perfect, right? It will have, aren't we still getting some updates to our software on Windows and other things?
Sure.
Windows has been there for decades. So
Yes.
this is going to happen, and we have to, but we want to be careful. We want to be careful and not be afraid, because if we are afraid, we will not make advances in technology. We have to, when the planes came first, there are people, so I'm never going to fly. In fact, a very famous football coach,
John
Madden,
Madden.
he always went in
Take a
the
train. Wouldn't fly.
bus 1 week before he will start to cover the match on the West Coast. There are some people like that. That's fine. But AI will get better. That's all I say. AI will get better. It will get better in terms of how it will help us manage our lives and healthy lives, emotional lives. If somebody has, in fact, we working with a company that may build robots that will go to nursing homes and engage late stage dementia patients and give them some semblance of life. Otherwise, they're just sitting there and staring and have no idea where they are. And it can, play their familiar music, bring pictures of their family, and this, spend time. A robot can spend time and provide emotional support to elderly. There are even people thinking of building robots that will help the elderly person to get gently from the bed and this and that. I just watch over them. What if, I just have a robot sitting in a chair next to me and just has a camera and just watches me if I kind of, fall down, or if it just raises alarm. It just calls a number. Hey, the man in the house is not doing well. And then, that is doable, right? I mean, it's doable. And so these are many things it will do. I think, AI is going to get better. It has issues, but, we will fix them. That's the engineer's job.
Right. What do you think are the specific areas, maybe in the next 5 to 10 years, where you suspect AI is going to have the most positive impact on humanity?
I think safe driving.
Mm-hmm.
I don't want, fully automated one is fine, but just enough automation so that, if the person is drunk, if the person is somewhat decapitated, has a stroke or something, it should figure out and just move to the leftmost lane and stop and put the blinkers on. Because safety in driving will reduce the number of deaths. We still have close
a million deaths a year, I think, from auto accidents.
30,000 to 40,000 traffic deaths, I hear.
It's a million worldwide.
Worldwide, but in our country.
Worldwide deaths worldwide from auto accidents, and I don't know how many people injured.
Exactly. Injury is even more serious, right? Because people get, they can't move and they're tied to their wheelchairs. So I would assume, that we have to give Elon Musk the credit because he just went and did it. Okay. Mm-hmm. So now all other car companies have to follow, right?
Yeah, I'm here in Venice Beach and I see Google's car driving around the neighborhood quite often with all the specialized cameras and everything. It's quite fascinating.
Right. So, all the cars are going to be there. That's somewhat similar to what happened in the 80s. Lee Iacocca of Chrysler fought tooth and nail to put the ABS system because he says going to add 500 or the the what is that safety bag, airbag.
Airbags, yes.
Yeah, $500 additionally, he said. And then once the Japanese companies did that, everybody moved toward Japanese, cars. Then of course these guys have to do it too. So you're going to see more of that. And I think California has said 2035 is the last year when they can sell gas-powered cars or something like that.
Right. So, but we have an engineering problem on that whole story. I mean, first off, I think it's, if you know anything about the mineral field, it's virtually impossible for us to provide sufficient amount of cars, battery powered, enough copper for all of these engines. So it's become so essentially what we're dealing with is a couple of things, I think, and this is a really important question. We have AI from an engineering perspective in its applications, or a scientific expectation. We have AI from a political narrative, which will often, frame things in a certain way, either positively or negative, to get elected and implement power. Then we have this use of, AI as enhancing human life and AI as exterminating human life, like used in military applications to fight each other. As an engineer, how do you think about those aspects, maybe the engineering problems versus the political problems, and then the subsequent, say, the benevolent aspects, helping people live healthier, provide health care, supporting the human development, increasing safety, versus its applications in a dark side, which is, use as killing robots and machines and ways of exterminating a perceived enemy? Because those are basically, we have the human element and its own biases applied even to an unbiased machine. We still have, right?
Yeah. Whenever this question comes up, I say it's not the AI is doing bad things. The humans are using AI to do bad things.
Correct.
So that doesn't change. Before it was stones, and then dagger, swords, rifles, etc. And now we have more lethal weapons. So I would like to focus on AI as a technology, just like we had other technologies, and see how, because we have a lot of sensing going on. Apple Watch tells you things and this and that. So how to make people live longer, healthier, happier, and so forth. The political side is, again, electric cars need not be driven by AI, though.
Correct.
Right? That is a different issue. Electric versus gas, AI, AI can be in gas-powered things too. Sure. So I think I will not worry about that. In terms of AI being used in weaponry, now we have these drones.
Yes.
That have been programmed to look for people, look for certain things, and go and blow up, right? So
like, kind of I want to interject there, because I had heard information, and I'm not an expert on this, but under the Obama administration was kind of the amplification of the use of drone use, and apparently some people say that 90% of the kills were civilian targets, or not actually humans, and they were working out this. And now, of course, we're in the middle of a war over in Europe, and drones are being used on both sides of the equation, and precision AI bombing. So, one time it used to be, hey, I got a sword, you got a club, and we go at it, and it's a direct conflict. But now, people are on the ground and they don't even see anything coming. Boom, they're just eliminated from the earth, from the negative technological aspects of these computing systems. So how do we figure this out as humans? How do we navigate through this? And will we navigate through it as some crazy person that gets access to power, which has been pretty consistent throughout history? If you look at the history of the world, there's always some psychopath trying to take out a bunch of other people, and then some other psychopath says, no. I don't like your version of the world. I'm going to fight.
But Wade, my point here is that why blame AI for it? Blame the humans who are doing that. Right. I'll take an example. when India was invaded by outsiders in the 10th century, 11th century, they were easily able to break the forts and other things because they had cannons.
Correct.
Indian kings didn't have cannons. They were still fighting on the horse with swords, and so then if you other person also has a horse and the sword, then you can play. But the other person brought a big cannon and blew your fort away, fireballs and this and that. So they had to. So there is this nice, nice book actually, but the topic is germs, steel, and what was the other thing?
Oh yes, I
that I forget.
It's a very interesting book.
Yeah, and describes the scene in a country in South America where there is this king, 10,000 people, and the king is sitting on, maybe a horse or elephant, very adorned, and he has all his soldiers. And the Spaniards, they had only 300 people, but the leader of the Spaniard military just came and arrested the king, and the whole thing fell apart because people were shocked because they were told the king is from the sun, and nothing can happen to him. So that's where he was, because germs, steel. Steel is the one that gave the thing, and germs in the sense when Europeans came to United States, the local population here at that time didn't have immunity, and there's a lot of massive, deaths and so forth. So what I'm saying is that weapons are, getting modernized. They've always been modernized. I don't know if I should blame the AI. Maybe AI is scaling it up. AI can probably do it more accurately and so on. But we need to look at why humans are doing that. I mean, that as long as we have that problem, they could even do with inferior technology.
So that's a great argument from the standpoint. There's some evidence that people would suggest that if we look at maybe one of the great technological innovations of the last century was the development of nuclear weapons, in that we now have the power to essentially exterminate the human population. We can annihilate ourselves.
Well, 100 times.
The planet will survive. The planet will survive, but we won't. Okay? Maybe 10,000 years go by and it'll redevelop, whatever, or evolve, but we won't as humans. Yet, there's significant evidence to say that the development of mutually assured destruction has created the most peaceful time in human history for the most amount of people. Yeah. And there's good. I think that's a valid argument that we can say. If we look at, I think throughout human history, we've been fighting 96 or 97% of the time, and the other part we're probably sick with the plague or some weird disease.
Exactly.
So is it your belief that the unilateral development of AI against opposing maybe governments will serve as a check and balance and eventually lead to a moot point where we start to evaluate ourselves in a different level? Do you feel that that's what's going to happen?
And now for a Bioptimizers fixed digestion tip: rapid cheat meal relief. Research shows that cheat meals can actually be an effective way to boost your metabolism. One key weight loss hormone, leptin, can be increased by up to 30% following a cheat meal. The challenge with the cheat meals is that all those extra calories and lower food quality can be hard to digest, which means you could be totally sidelined with a food coma after big cheat meals. The solution is to take strong digestive enzymes like masszymes, which will help rapidly digest and break down the extra food. 3 to 5 capsules before or right after your cheat meal can make a huge difference in how you feel following the cheat meal. If it's a cheat day with multiple large meals, you might want to go up to 10 capsules or higher to help you power through all that food. To save 10% on masszymes, go to masszymes.com. That's MASSZYMES.com and enter the code CHEAT10 at checkout.
I don't know, but I think it all depends on whose AI is better.
Mm-hmm.
Are we sure that we have the best AI, or if we get into that situation, what's going to happen? I think there was even some mention in the news and so forth that all the countries have to sit down and kind of have some kind of a disarmament situation with AI and so forth. For example, AI is creating havoc by spreading misinformation, right? Then people ask me, I said, true. But if you have read a book that William Safire wrote, Scandal Mongers or something like that years ago, when he wrote about what happened during the election time of Thomas Jefferson and John Adams and so on, they were saying pretty nasty things about each other. Through their surrogates, they're printing paper, but they were printing in papers and so forth. So it didn't spread as fast as it can spread now. So speed, what computers have enabled is the speed at which it can go, right?
Correct.
Put a false thing in Facebook, immediately it's up there, right? So, so what I'm saying is misinformation is not new. In fact, one of the president's wives was accused of being a prostitute years ago, not now, 17th, 18th century or something like that. So, again, it all comes down to humans. So what I'm saying is we have to work towards promoting harmony, understanding, and sisterhood, brotherlyhood, and all the values. And we have to do that. And hopefully technology will be put to good use. But although the mutual destruction thing is there, still some countries are threatening to use it if they think it would help them, right? So how do you square that?
So I believe there was 3 occurrence in the last 20 years where there were perceived nuclear launches. I think there was one of the most famous one was a General Petrov or something like that in the 1980s, who the early warning detector system had detected 5 missiles coming into the Soviet aerospace at the time. And his human element was able to determine, say, I don't think this is right, because you had a period to essentially manage that, and the world was safe. We didn't get into a mutual missile launch. And then I think one of the nuclear treaties that was implemented later on, because they have about 30 minutes at that time. Now with hypersonic technology, it's less than 5 minutes. And there's right now what's going on is a removal of some of the nuclear treaties that were put in place because there is no time. Essentially, in a response, this would be turned over to AI. Where do you feel that there is a strong global consortium of people who understand the technology that are coming together to try and manage the potential negative side effects or the potential benefits?
I don't know, but the human nature is to get to the table only when there is some kind of an equal power on both sides. That's just the nature of the politics. And, somebody said that it's a time to discuss these things, the disinformation campaigns, and the issues that you are discussing. There have to be some kind of a Geneva Accord that is there for the AI capability and so on, because decisions can be made very, very fast, and it could be a wrong decision, like you were talking about the 1980 situation. So, yeah, but it's above my pay grade, I like to say. The governments have to be involved, and everybody thinks AI is going to be the technology of the future. So I'm sure nobody is willing to give up any lead that they have, or they may like to, that is probably what, happens. So I think Dr. Kissinger had some kind of a comment a few months ago saying AI is probably even more dangerous than the nuclear technology or something like that, because we don't understand it as well as we understand the other one. The other one was based on physics, whereas AI can make stuff up.
Which was a great point. So one of the things that's occurred in the last couple of years, which is now, I don't know what the influence of AI was on this. Maybe you have some insight. So we had the global lockdowns that have happened during COVID. John Hopkins played a big role in some of the determining factors.
Yeah.
There's large part of the population that felt comfortable with the decisions that were coming out of our medical and government institutions. And then there was a percentage of the population that was violently opposed. I'm from Canada originally. And of course, that culminated with the trucker protest and some of the dictates. And now, as we're seeing post hoc, 2 or 3 years down the road, some of the statements that were made as blanket statements from governments are categorically false. And anyone who challenged that was labeled as misinformation, and AI essentially was used to evaluate whether you were communicating accurately or not. And I'll look at in this case of one of the people that I followed during this, because I didn't know. And I followed Brett Weinstein and his wife Heather, who are evolutionary biologists, and they have some interesting concepts about. And I like them because they weren't jumping to conclusions. They weren't for or against anything. They were just like, let's find this. And they were terminated from some of their platforms, as were some of their colleagues, and which are now found to be accurate in their assessments. How do we manage this? The labeling of misinformation on a kind of a quick choice of AI, which facilitates that on a wide scale, versus letting whatever go. It's a circus of ideas and comparisons, and we'll see what comes out, which has been the traditional.
I think what I would say, if people's the pandemic was new, we didn't know what was going to happen, and thank God vaccines were found. Just imagine if there were been no vaccines, COVID vaccines.
Well, the jury's out on the efficacy and long-term effects of vaccines.
Long-term, definitely. I think long-term, we don't know. Long-term effects, we don't know. I have had 5, and I wonder about it. Will I grow a horn or a tail, 10 years from now? I don't know. But I'm still here. And, I have some conditions that would have been made the thing very bad. So far, I have not had the COVID, knock on wood. So all I'm saying is, I don't know the full story. I have seen, both sides. They show in the news. But when a government is faced with a pandemic whose origins are not very clear, and people are, dying, especially elderly people and all of that, we don't know. I think it's very difficult to expect that all decisions will be purely rational and perfect. I mean, post hoc, hindsight, as we like to say, is 2020, right? So all I'm saying is that we should do this analysis so the next time there will be another pandemic, right? There will be another pandemic. That's what everybody says. Maybe not now, maybe 100 years from now, 50 years from now. So we probably will be wiser and so on. But we lost 1 million people in this country. And, we can get into a conversation. If only everybody had worn a mask, maybe we would not have lost that many. I don't know. I see in India.
I would challenge that. I would challenge that with the current.
Exactly.
Levels.
That's right. Yeah. I think it's perfectly fine. We don't know. In India, nobody is wearing a mask. So I see cricket matches, 100,000, 50,000 people screaming at each other. Nobody is wearing a mask, and maybe they have herd immunity. I don't know. So these are all still, because the last time we had a pandemic was 1918. So it's not like it comes every other year that we can fine tune and get better. So this is after 100 years almost. So I think. It's possible some people played politics, possible some people were not, because again, it all comes to humans.
Sure. Well, but this is a great, I think this is the pandemic, the development of AI leads to this question of human determination versus artificial intelligence determination. So for example, my father was in the hospital, and because of government ordinance, he was getting heart surgery. They kept him in the hospital for several months beforehand because they weren't sure what to do with him. My mother was not able to see him.
Oh, that's
so. And this was a government mandate. And there's plenty of people who loved ones died. Fortunately, my father survived, but he was in hospital on potentially his deathbed for a couple months. My mother was not allowed to go see him.
Yeah.
And that was determined by someone in a faraway place that will never interact with my parents about the decisions between my mother and their father and how they might spend the last few months of his life or her life. I have other friends who, for example, I couldn't see certain loved ones. I couldn't travel back to Canada. There was all sort of regulatory things. I wasn't allowed into certain places. I wasn't able to make those determinations because of what was considered a general bias of the population. And so, and some of these things are still ongoing. There's still aspects, there's the social implications of these decisions. And so that brings people, I think people like the sense of autonomy as a human.
We are free thinking.
Right.
Free thinking people. Now,
so we had an experience where we were our voice was curtailed and our decision making and our medical and our emotional social situations were directly interrupted by government authorities using some of these technologies in order to do it. I'm sure they're saying, okay, they're doing this for what they feel is the right reason, but at the end of the day, they're taking away that autonomy from the individual. Where do you see AI and humans navigating control or coercion over autonomy and freedom, which is
I would take AI out of this completely. What has AI to do with this? I mean, you can do all of this without the AI.
Well, sure, yes, but if you look
Right?
let's look at the case of Brett Weinstein. So Brett Weinstein, I think, is him and his wife are evolutionary biologists that were on the cutting edge. They were leveraging people like Gert van der Bosch, Peter McCullough, one of the strongest virologists in the world. All three of those individuals were terminated from the internet using AI algorithms from expressing opposition to some of the dictates coming from various governments. So that the individual wasn't able to make a decision because AI was distorting how they accessed information to make their own decisions. And so what I see is a potential consequence of how our lives go from AI. And so how do you navigate that?
Yeah, again, this can be done without AI. Somebody at Facebook can sit and look at this. So, AI is an enabler, but so I wouldn't bring AI into everything, right? Because
so you're saying that's an independent issue.
Yeah, it's because somebody, when Facebook has misinformation, when they were doing it for Indian elections and so on, there are also people, you can't program AI for every variation of misinformation and so forth. So they actually have a lot of humans looking at the posting and they do that, right? So I don't know why we blame AI for this.
Okay.
I'm sorry, and I'm not trying to be flippant, but
no, I'm not asking you to be. I'm asking these questions because
what I'm saying is somebody decided in some platform that this is, and can I say something though?
Of course.
From platforms, private platforms, you can be taken in, you can be removed. You can't blame a government for that. Private entity is private entity, right? But that's blame Facebook. What Facebook does is what Facebook. It's a private company. It doesn't
But yes, so that's the question. I think it's what Section 232 or something of the act. They operate as an independent platform, but when they start to edit, they are now not a public platform, which is the issue. And so that becomes the point. Okay, you're a public platform, but the second I move into an editorial, I'm not a public platform. I'm moving.
Congress has been talking about it. Somebody has to make a decision. So what I'm saying is this post hoc analysis is important. Okay. And so we're better prepared next time around. And people make mistakes. And sometimes they make mistakes knowingly. Sometimes they mistake because they may be held responsible if something is not done and their job may be in line, or their career may be in line, or there's so many things happen. But what happened with the pandemic, my feeling was this: if I was born and raised in a democratic country, India, I'm living in a democratic country, and I like to trust my government. If they say something, I say, okay, mask, if you wear it, maybe it's not proven, but if they think, you wear a mask, you might help others not get sick. In fact, when I went to Japan first time in 1986, I saw a few people in the train wearing masks. So I asked somebody, why are they wearing masks? They said, oh, they have cold and they don't want to spread the virus to their
Correct.
friends. I said, oh, that's a very good thing. And I like that. And I've seen it in other Asian countries, right? So that is how and this is a personal opinion, right? And I'm fine if the government says, we have to, loss of freedom versus general well-being. That's such a interesting trade-off, and nobody has a perfect solution for it. If if suppose, let's say, I don't know. I mean, I think I respect your opinion on that, and I think the autonomy, where you put the slider in autonomy versus the general health, autonomy versus the government saying. So it's a moving thing, and it is individual. There is no you. It's like you say, I tell you, oh, if the government says I should wear a mask, it will save. I'll do it, and I won't complain about it. I'm fine with it. That's true. I'm losing autonomy. I'm losing another, but I feel like I'm like a soldier fights for the country, for the well-being of people, to protect our freedom. So soldier does that too, and sometimes soldiers have to kill others, right? So
yeah, it's one of the
so,
ethical issues
so
of soldier
where do you draw this? I always say it's a personal thing. Your knob may be at here more towards autonomy. Mine may be more here, and both are fine because we live in a free country.
So, which ultimately comes up to the ethical aspects of the individual versus the general, the trusting of the government, and AI brings up a new level. So, in your opinion, should AI be under the guidance of a government agency, or do you think it would be better under private institutions?
I think it depends on what we are talking about, right? Because in United States is basically a capitalist country. We want companies to thrive and make, and so we want as few government controls as possible. But still, we are all accepting the speed limit, different speed limits. 55 mostly, and then if you go to Montana, it is 70, and in cities it is 25. So I don't think I'll go and say, oh, who is this government to tell me I should do 25 in a local street here? I'm going to go at 80 miles and then I'm going to. So we don't do that. So there are certain things we accept from the government. Like when TSA says, you can't bring certain things into flight, we accept that. So it's not like we are totally Wild West. So again, this comes to the issue by issue, no general thing. And hopefully there will be, broad consensus that comes through Congress, that comes through judicial system. I mean, we actually have 3 independent sectors in our country, executive, judicial, and there are checks and balances. And so hopefully we will all arrive. But all I'm saying is it's not like we are a lawless country. And often it is said we are a country of laws, and laws are made hopefully for, public good after conversation, discussion. So again, it depends on the issue, right? Whether AI should be certain aspects of AI, probably the government will have regulation because some cities are banning face recognition, right? They said no, we don't like it because it may be biased, so forth. So we need regulations for some of those things, and there are regulations for safety of products. Right. And but I used to watch a show in the 80s, David is relevant, so somebody who will have a half an hour show on all the products that don't work well and this and that. I forget his name. First name is David. So, so there are issues. So some parts of AI probably should be under government and some should be under private. And this will be an ongoing conversation because we don't know exactly how it's all going to work out. But AI should be ethical. Very important. Where is the ethical consideration comes? How you collect data? How you curate it? and whether it has bias, whether it favors one group versus, those are all things that have to be discussed. And so ethical AI is what we need, and AI with integrity is what we need after seeing what Bing bot does.
Sure. Yeah. And I think I can, as a student in history, and it brings up also, I think with great power comes the great responsibility was an old statement, and AI definitely seems to be a great power.
Yes.
You would agree with that.
Yes.
And so,
yes.
yeah. And its applications, how, as an engineer, do you put ethical considerations, let's say, in the development? Because I think that's essentially what the crux is.
Yeah.
How do you, and you could go back to Greeks, and they, I think it was Plato or Aristotle talking about ethics, literally the concept of ethics. So what is the good of the individual, the good of the state, the good of the world, the good of mankind, the short-term consequences? This is a project. I was listening to Jocko Willink talk about war, and he says, if you're going to go to war, you have to have two things that you have to come to the conclusion is, and that is the willingness to kill and the willingness to be killed. And he says, when I say the willingness to kill, I'm not just saying the willingness to kill your enemy, is to understand that you're going to kill innocent people inside of this. And you have to be okay within yourself in order that this is going to happen. And there are going to be mistakes made. And I was training with a Navy SEAL recently talking about how someone was holding, one of the terrorists or enemy combatants would hold a baby so the sniper wouldn't pull the trigger. And their team was getting fired on, and the guy said to the sniper, "You got to pull the trigger." And he eventually did, and killed the kid, killed the person, killed the baby. And he has to live with that the rest of his life. But that's what was saving his comrades who are in a lethal force battle. And so I think that's the issue, is how do we as humans plug ethics in, and how do you think about it as an AI engineer of what are ethics? How do we agree upon them? What are the fail safes we put on it so this cannot be manipulated, or we can manage the downside of the benefits of the technology?
Yeah, let me address, if it is medicine.
Mm-hmm.
Privacy of medical data is well understood. Even when you go to your doctor, they will ask you who else can see your report, who else can the doctor talk to. You will say your spouse or your brother, your mother, and so on, and they strictly follow it. Any leakage there will be considered unethical, and it will create problems. Likewise, if you go to an attorney cannot knowingly lie in a court, and the attorney will be barred or fined, right? And we saw many evidences of that. People would say outside something in the TV, but when they went to the courtroom, they didn't say any of that stuff because they know the judge will
Right.
them. So that is ethics of the profession. The ethics of a policeman is, so we have for every profession. As a professor, what is my ethics? I should teach well. I should grade people based on their scores, what they write in their exams, and I should make myself available for them when they have office hours. And when I do research, I have to do it ethically, not falsified. So we understand for each of our professions what the ethical rules are. Now, when it comes to AI, it depends on the application. If it is face recognition, I cannot go and collect your face from the website and use it to train my system, because you are a citizen of the United States. You have full rights to be free of such intrusion. I can only take faces of athletes and politicians, actors who are in public domain, maybe. There are strict guidelines, how to collect faces for faces. There are some systems that have collected 2 billion faces from the web and so on, and they get into trouble. ACLU and others don't like that. So in medicine, we understand the data has to be protected. The data has to be mined. So the privacy of data is very important, and no falsification and things like that, right? And NIH researchers are extremely careful about those things. So AI has to do the same thing. It has to collect data in an acceptable way with consent, from people, and then if there is any issue in terms of the decisions it makes, whether it is fair or not, it should continuously evaluate it. There are methods available. See, the thing about AI, where it's an algorithm, we all think it is some kind of a superhuman, but it's a
Well,
computer
that's the
algorithm,
anthropomorphization
right?
of AI, right?
Computer algorithm. And computer algorithms, we can test them, can't we? We can give tough
Yes.
examples and see how it behaves and so forth. So we can put the bounds on the performance and this and that. We know when the performance is acceptable. So we can try to probe it. Like we probed our face recognition system, whether there is a bias to gender and skin tone and so on. Yes, there is. And then we go and fix it. So if AI is unethical, it's because the person who designed the AI is not being careful.
Correct.
AI itself is not unethical. So we have to control, and we have to be, as I say, any good thing can become bad in the hands of a bad person.
I see. So let's assume that we get past the potential abuse of AI in a negative way, just like getting past the potential abuse of nuclear technology or radio technology, all the technologies that have transformed humanity. How do you see the interface of AI and humanity, say, over the next 100 years? Where would you see that interface being? Maybe 10 years, 20 years, 50 years, 100 years? How do you see the future as an engineer, as an expert in this industry, and how it will enhance humanity? Let's just cast the negative side away. Where do you see this going?
Somebody asked me at a meeting 10 years ago, what would be my moonshot connected with education? I said, I'd like to have one physical teacher, 30 virtual teachers in a class of 30 students, so that each student can be catered to. What happens in elementary school, the teacher has 30 students, and the teacher usually takes care of the middle 20. The bottom 5 who are having difficulties, and then the 5 who are extraordinarily brilliant for that class, they usually get left out because teacher cannot. So it will help in education. It will be human interface. It will teach you. AI can teach you, and it can figure out how well you are doing and come with various tools, and it can get you information where you need. And so you will all be much. Listen. My son and daughter, when they were 10, they knew a lot more than when I was 10.
Mm-hmm.
That's just the nature of the information age. And
Yes.
they were very able to resolve more complicated things and so forth. And so that's just the way it is, because I know it was 1963 when I was 10 years old, and we didn't have internet, we didn't have anything. In fact, when I came to United States in 1977, my idea of USA was based on some John Wayne movies.
Right.
Or the movie Hatari, where John Wayne goes and collects a lot of animals in Africa for a zoo. And I had no idea. Voice of America, I heard, and I come to Purdue, Lafayette, and I'm saying, oh my God, where am I? There are all these cars and wooden houses and cold weather. Right? So what I'm saying is people will be more informed. Mm-hmm. People will hopefully live longer. And AI, that the interface, it will be like having a trustworthy partner who is there by your side in every which way, and I think that's potentially possible, and it can read your mood swings maybe from your expressions. It can help you, if it is a robot, it can help you when you fall and get you up, or it can call for help. It can monitor what you eat and give you an advice. And maybe you had a donut in the morning, maybe you want to skip that French fries in the afternoon. It can very easily do that. I mean, the whole thing is it will be an intelligent agent, intelligent person next to you, and so on. So that might, and of course, it will help disabled people with visual impairment, people with not able to hear. It can listen and translate the sound into something else. And for people who can't see, it can give you audio feedback, and people who can't have full mobility, it can help and tell them where the potholes are. And so I mean, there's endless. But
yes.
Finally, whether it will happen or depends on the financial models and so forth. Right? Doing good doesn't always bring money.
Yes, we have an associate professor at the university that we work in conjunction with, who is an expert in AI and its application to genetics. And the idea is, I believe that they envision one day that we'll be able to preemptively use gene editing for diseases or potential things down the road. And then we get into the next phase is, okay, well, let's take that 10, 20, 30 years up. Do you see the application of AI in twofold things I'm going to ask here, because I think we're going into the medical field, which I think, hey, do you anticipate that AI will be used for genetic screening in the production of offspring?
It can be done without AI.
Yes, of course, but AI is going to probably, again, its ability to accelerate.
No, all I'm saying is AI is not going to do something new that we can do without AI.
Sure.
So it comes to
It'll make it commonplace, though. What do you think?
No. Again, that depends on, for example, you can't just have the world full of boys.
Correct. Well, we had that experiment in China, which is probably doomed the population in population.
So all I'm saying is, so there will be a correction. So I think again, we are applying, we are putting things to poor AI. See, I told you, poor AI, I always say, because it's so misunderstood, everybody blames it on everything. But every time, not all the time, but most of the time when you raise a question, can AI do it? My polite answer is, you can do it without AI.
Sure. I think the thing about AI, it provides scale.
Yeah, I understand. And again, humans enable that. It's not like AI suddenly decide, oh, okay, I'm now very good at doing this gene editing, I'm going to go and do everything. No, it's not it. The human, again, comes to that. That's why, so we need to, as an engineer, I feel like AI is like my child, and who just says nasty things about my child all the time. And so I have to defend.
Of course. And that's why we have you on this podcast, because again, there's the anthropomorphization of AI technology. So do you feel, because this is the ethical questions that a lot of us run. So if I understood you correctly, you believe that we'll ultimately course correct any mistakes that we make over the long term. There will be some short-term, midterm liabilities, but as a general sense, we'll correct it over, say, the next 10, 20, 30, 100 years as we move forward into the future.
Humans, we like to live. We like to live.
Yeah.
And we like to have our generations and grandkids, and everything has to continue. So there is always there have been wars, but
yes,
still here. So I think rationality, humans are rational.
So we go to the next piece as we're kind of running this whole story, because I wanted to kind of go through I think you've outlined some very good positive components that will likely emerge. For example, in North America, we have an aging population, and we don't have an ability to take care of them all moving forward. And so AI will probably serve that purpose.
Let me give a little twist on that, Wade. If you have siblings who are here and the elderly parents are in India,
yes,
it's a lot more stress.
So
how do you take care of them? Putting devices in their house. Some people are doing it, watching cameras and having instantaneous conversations using WhatsApp and this. When I came to Purdue in 1977, telephone calls were so expensive. I didn't talk to my parents for 3 years.
Yes.
First time I called them was 1980, because it was $1, $2 or whatever.
Oh yeah, I remember those days. Yeah.
Right? And then I'll have to do a person-to-person call so that they won't charge you till the person shows up. Now, when I called my wife in 1984, she didn't have a phone. They had to go to a neighbor's house to pick up the phone. So we wait person-to-person call. And always that my neighbor's grandma took the phone, and then there is conversation in English from US, and she says, "Who are you?" Yeah. And then I try to intervene. The operator says, no, you can't intervene. She cut off the phone. But now WhatsApp, Google Meet, it's all there, right? So anyway, all I'm saying is technology has helped. So when you have elderly parents in a faraway place, the AI is a useful thing. It will monitor and so on.
Yes. One other thing, I guess, on the aspect of AI and its infusion into kind of robotic technology that's kind of the expression, AI into, robots, and robots replacing human interaction. So one of the things I think was fascinating, I go back in history. Humans are fascinating, and they're with tech and their ability to make things that wouldn't seem logical change. So if you look at the advent of beta vision versus VHS in the 1980s, so beta was superior in any form, its production, the size of the competitor, the video, the audio, all that sort of stuff. But the porn industry went with VHS, and that led to the proliferation of VHS stores instead of beta vision. No one thought of this.
I was wondering why Sony is the one which had beta, I think.
Yes.
Right? And I said, why people, I didn't know the reason.
Yeah, I actually am friends with a person who went all in on beta vision in Japan back there and lost his shirt on it, and then developed another company later on. But it was fascinating. So there's these things that don't make logical sense. Do you feel that AI fused with robotic technology will then serve as companionship for humans, either in elderly situations or in romantic situations for people who can't find a suitable candidate of the?
I think the first one is definitely true. It's happening. We are seeing some proposals to our program at Hopkins, people designing robots, for interacting with people with dementia and other cognitive impairments. That's happening. The romance thing, I don't know. There is a movie, right, where there's a guy falls in love with a computer or something like that. The fellow who Johnny Cash, what's his name?
Yeah, Joaquin Phoenix, not Joaquin.
Yeah. So I thought that was really crazy. I think I don't know. I watch Bill Maher once in a while, and one of the shows he says people should go out and date more often, then everything will be fine. That's what he says.
Sure.
Yeah. So I think what has happened, the social media, is people are becoming happy with their interaction with Facebook or whatever that. I have Facebook account just to figure out what it is. I hardly post anything. I don't have a Twitter. I don't have TikTok and so on. So, I think that definitely so it's again, I wouldn't blame AI for it. Social media is probably more efficient, et cetera, but it's a computing, it's a network computer server and so forth. So, it will do fine without, AI. So I think that's a real concern. I'm told that people are getting married late, and many of them are, a number of singles is going. People are happy with their work and then with their social media interactions and so forth. That is a worrisome thing because we are humans. We need other humans to chit chat and be with and things like that. So hopefully, but again, I would be very careful in blaming AI for that.
No, I'm not blaming AI.
I'm not saying you are, but I think, I'm saying that is a concern. The social, because this is new, this form of interaction in the last 10 years has become very intense. Well,
I'll use like the social interactions, for example. Jordan Peterson, the psychologist controversial psychologist from Canada, was illustrating one of the issues, for example, on dating apps, in a dating application, that females will only select 4% of the males on the dating site, where men will select 50% of the females. So basically, this leads a lot of men out of the equation, as that is the general way that you introduce. Before, you grew up in a small community, you knew 150 people, you married the girl down the street, or in cultures such as India, which has probably produced one of the more successful populations over long periods of time. Okay, there was a lot of arranged marriages, for example, that the parents served as a screening agent where the youth couldn't figure things out very well.
It has gone down quite a bit now. Yeah,
yes, it's gone. It's changing. It's changing, and we have a demographic difference. So I think India just went past China in population growth just recently, right? And of course, the one-child policy was implemented in Chinese culture, which is now going to have very deleterious consequences for the Chinese culture over the long term. And then we have the Malthusians who say we don't have enough stuff. And then we have the other people who say we'll always overcome technology. Who knows? But what I'm talking about is, okay, there is a segment of particularly in the male population, and I'd say middle-aged females who now are having difficulty finding romantic partners and producing more children. And it's an evolutionary part that happens in all civilized, like the more advanced this technology has, the birth rate drops significantly because it takes more time to get used to technology. Do you feel that perhaps that the positive aspects of AI will increase compatibility in human relationships, or have people exit out of computer? Because I could get, say, an AI robot that knows everything about me and answers perfectly, and I have this beautiful partnership with someone where I may have a little bit more conflict in a regular interaction, or a little bit. Well, how do you see that playing out in its impact on humans?
I think there are always certain percentage of people, who prefer to be alone, single. But I think by and large, I don't think AI will have any impact on these things. I think people, we are humans. We need human touch. So I don't know. I mean, I don't know enough about the social aspects of this. I married my wife almost 40 years ago, and we're happily married.
Yes.
I mean, the fights we have is whether I have additional, piece of muffin or a toast. At that level, I always tell people, if you are fighting over that, your marriage is good. So I think people are getting married. People are so the social thing is sometimes helpful, because what happens is, in the good old days, kids did not leave the parents' town. Pretty much everybody had locals. Right. Whereas now, I came here in 1977. My parents were in India. And so I needed some help in terms of social. For me, it was TV shows, basically, watching Bob Hope movies and cartoons Saturday morning. I didn't watch these Tom and Jerry cartoons growing up in India, so I made up for it. And then, so there were some, because we are in a new place. So, TV was my friend in some sense. But then you grow out of it, you go and find somebody, and you marry and you settle down and so forth. So I think this is, I do see, in my own family, some of our men are getting delayed. They date, sometimes it doesn't work out, whereas daughters are getting married. I think, somehow it works out. That's what I'm seeing in my family. Daughters are able to, find a match, and it seems to work well. But for boys, it's a little bit harder. And I'm trying to figure out why. It may be the expectation game, and also the more educated they are, it becomes more difficult, it looks like. If you just graduate with undergraduate degree, take a job and so on, you come into contact with young people at a younger age, at work and through friends and so forth, you have more opportunity to meet. Whereas if you study graduate school and MD and PhD, you're so constrained, you're so busy with your studies and other things, you don't have time to go out and meet people. So that I'm seeing, because if you want to be a doctor, you are 30 years before you can come out of it.
Correct.
At 22 undergraduate, 4 years MD, 26, and then you have 3 years of residency, 1 year of fellowship, 30, and you are busy. You are so busy, right? PhD is the same way, 29 years old. I was 27.
Plus the potential debt load that may be also incurred on that.
That's right. So I think they're not able to meet. And I think, whereas I've seen my friends, sons and daughters, when they just stop with undergraduate and they go to work, and they're able to find partners faster. So I don't know if it's a very small sample size, but I can explain it in the sense that when you do these advanced things, you are going to be busy at school.
Yeah, one of the things that I was listening to Brett Weinstein on Joe Rogan, and they were discussing AI and evolutionary biology. And this is kind of the question where I'm going there because I wanted your opinions on it. I'm ignorant on both topics. Brett was saying that if you look back, say 100 years ago, 150 years ago, whatever, you could take the human software or the human hardware, the human body. You could be born in India. You could be in the plains of Africa. You could be in a city in New York. You could be in a tribal situation in South America. And over the course of your childhood, you would develop the skills to integrate into that society. And he said that the rapid development of technology itself is extending the time, which you just illustrated, in order to become, say, competent or proficient within the field, which is having negative impacts on the reproduction of the species. And he said, okay, now you go 20 years, you go to school, you come out, you're still not at the top of the field. You got to go 30 years and 35 years. And then even then, things are advancing so much to stay on the front of this edge. Do you see that maybe AI could be a potential bridge between that for us when you talk about education specifically? Because that seems to be the issue. Do you think that AI could potentially bridge that gap of the specific capabilities and individual education so that you become competent sooner in an AI human interfacing world?
I think it depends what profession you are talking about. If you are a surgeon, you still have to develop your skills in surgery, so that won't change. But but if it is a pure IT computer kind of a thing, then maybe it can happen. I can see, but it depends on the particular specialization, whether things can be made faster. In fact, when I studied engineering in India, it was a 5-year program. Now it's a 4-year program, right? Everywhere it's 4. And people can actually take jobs and then get their skills and then they can move and so on. So that flexibility is there. But there are some things involving physical, things like surgery and other things. You got to go through the skills. Like neurosurgery takes 7 years and things like that. So I don't know how AI can help them to learn better, but learn faster. But you may see the Meta ad where they have a synthetic heart picture and the doctor can cut into it and get practice and so forth. That is very good, but you still have to learn to cut into a real person's body and go to the heart and so on, right? So that takes time. So certain things cannot be made faster, but some can. It depends on the profession.
Do you think that AI fused with robotics could maybe have better outcomes for surgery in time?
They're already being used. I mean, robotic, Da Vinci is there, as you know, and then for heart valve replacement, people are using robotic arms, but they're controlled by humans. They put their hands inside.
That's right. Yes.
So that is it. But I don't know if just an AI arm will just come and try to open you up. That's not going to happen. There will be a cardiologist using a robot because it improves the precision and it removes some of the, maybe cardiologists can practice a little bit longer because they're not doing it with their hand and the robot will control, they can set it up. It's possible.
Yeah, one of my friends is a vascular surgeon from Harvard. He actually put the first stent in the human body.
Okay.
And he was talking about the advances in technology, what it used to do when they did heart surgery when he started versus heart surgery now. But it'd be 6 months, you'd have to open the whole body up. Now you're in 48 hours and you're done,
many procedures are the arthroscopic, possibilities are there. Yeah, that definitely is a positive thing. Yeah.
Well, that's what I was saying. Do you think we will get to that aspect where we'll have such a sophisticated level of knowledge and precision through the use of AI that we can actually produce superior outcomes than to human interactions over time, like 10 years, 50 years, 100 years?
Yeah, I think
will it be Star Wars and the robots are working on us?
Yeah, that is okay. I don't think that will happen, but it will make the doctors more positive outcomes. The human errors will go down, and people can probably have shorter stays in hospitals and so forth, less expensive. So it'll have overall effect. The robot will earn its cost, over couple of years maybe, and then it's just making good money for the hospital. So, but still, I think even for anesthesia, it's like a pilot, in an aircraft, takeoff and landing. They probably do it, but once they set the coordinates, it's almost
Automatic.
flies by itself, right? So, but still, you have two pilots, and
Yes.
because what if one pilot has some health issues, the other person. So there are always two pilots, right? So I think safety will become better, better outcomes in hospitals, faster, turnaround, and so on. So those are all, good things. But human will be there. A cardiologist will always be. There's no robot cardiologist that I will let
Right.
my rope. No.
Yeah. C3PO is not going to be working on you in the near future. Got it.
Yeah.
So we now are faced with, say, AI potentially replacing a lot of, I would say, white collar, monotonous type of activity in organizations. And right now, as a president of Bioptimizers, we are being pitched with various AI systems for advertising, AI systems for
Receptionist, for example.
Receptionists, customer service interactions, and they're getting increasingly intelligent, say on responding to general customer service inquiries and things like that. As someone who's running a company, what was how do you? I always you're balancing the responsibility of the productivity of the company versus also making decisions that enhance the well-being of the individuals into it. And of course, efficiency is part of the question. How do you see ethical entrepreneurs using AI in a way that enhances outcomes overall, but may cause displacement of people in the interim? How do you see that playing out over the next 20 years?
Yeah, but this is an issue since Industrial Revolution.
Yes.
Right.
Of course, this is always the conversation, right? The machines are going to replace the people, the computers are going to replace the paper, and now more paper is being. So how do you see that?
Yeah, I think it has to be managed. Basically, what I would do is the people's skills have to be scaled up. There will be some temporary disruptions. For example, when I was a student at Purdue, if I wanted to buy an air ticket, I will go to a physical travel office. There'll be 3 people sitting behind the counter. So they'll help me. They'll look at the flights and so forth. I'm doing it on the web now. You go to United, they only have 2 people there in the counters just to help you if you had some stay. Otherwise, everything is automated. So what happened to the people who were there before? I hope they studied or they got additional skills, and they are probably good. We still have 10.5 million openings in this country.
Mm-hmm.
Jobs, right? It's not like we don't have jobs. There are jobs available. So it is always like that when a new technology comes every time. Internet basically killed the travel service business because you can do it yourself now. Even airlines don't have those offices. And I used to have a United office in Rockville. I like to go now I still go to my bank. Once in a while, Saturday, say hello to the ladies and then put some money, take some money. And my family said, you are the only person we know in the family. We all scan and we deposit.
Yes.
Yeah, fine. But I like to go there, and during Thanksgiving, I take them some cupcakes, the Christmas cookies. I take them. They're happy to see me. I'm happy to see them. And I think I enjoy that. It's my choice, right? So, but the banks have fewer people now also. I noticed that they're not fully. So
Absolutely.
every technology has that issue. So people it calls for more education and building more skills, and being able to cope up with that. So we should not stop progress in technology because of this. We just have to enable people to cope up with the new technology, which is good because there'll be high-paying jobs also, right, compared to what was paid before.
So in that, as an engineer, how do you suggest younger people, or maybe people in middle life, and they're faced with the interactions of AI? How do you advise the individual to get up to speed on AI and the positive benefits so they can leverage it in a way that enhances their life? How would you suggest that to people?
Yeah, I mean, there are, online courses and this and that they have to take. I'll tell you, when my students graduate, now it's a little slow, but till last year, in 2019, when one of my students got a job in Amazon, his salary was more than mine. Okay. So because he had the special skills in AI that Amazon wanted. So I have 25 to 30 PhD students in California. Five in Apple, 10 in Google, 8 in Amazon, Facebook, and this and that. And the salaries are very good.
Sure.
They were making, but then
I understand that.
That creates the issue. If you don't have that education, what kind of jobs are you going to?
Exactly. That's what I'm saying, because if you're looking at the intellectual capability on a standard disbursement or deviation of academic proficiency and IQ across time, there's only certain people that are going to be qualified to be able to make that. How does the average person of average IQ interact with AI in a way that helps them in their lives?
I think that's a tough question, right? Because God has given us some gifts.
Yes.
But they're not getting money just for showing up at the work. They work extremely hard. So you again make the work-life balance, you bring it, whether you want to work for these companies where there's no separation between weekdays and weekends and very high pressure. So because nobody gives you money just like that. So then I would say to this person, you decide, what kind of work-life balance you want to have. And people can be happy with moderate salary also, right? There are many places in US we can live. What is the average median income?
I think the average median household income is around 68,000 in the United States.
You cannot live with that salary in California, but there are other places. So we have to make a personal choice. And if AI can help us to get sharpen our skills too, that it can, there are programs that you can do. But it's a tough one. Not everybody, there are people who go to Wall Street, make money for 5 years, and then they quit because they can't take the pressure, right?
Yes.
And so forth. So AI as an education tool, it can do that. But there are education software without AI, which can also, you can register, take online classes, or go to county community colleges. They do provide additional courses and so forth. So it is now every 5 years technology is turning.
Yes. It's very
so we need to, and even in my own job, I'm not doing research now in what I did research 10 years ago. Yes. So I have to also retool myself. Otherwise, I won't be able to write cutting edge grants and bringing proposals and fund students. So I have to learn. When one of our friends' daughters said, "Oh, I'm 30, I can't do anything and learn anything." And I said, No, person, I'm 70 in April. I'm still learning new things, and that's the way it works. So we have to have that positive spirit in our life so we can, learn and not have anguish. That we are having average IQ, whatever we have, we can improve on it. Nobody says when we are born we didn't know anything.
That's right.
Yeah. So we study, we hard, and some of us harder, some not as hard, some have other interests. But finally, we have to find a personal peace with where we are. Because I always say, once you're 18, where any decision you make, you are responsible for it. You are a grown-up. So if you don't make a good decision, that there are consequences. But we have to be at peace mentally, emotionally, with where we are. Because you don't want to live your life every day unhappy, right? So if we think we have a problem, that somebody else, has a sharper, that is good. Maybe, hopefully, that intelligent person will do good things that will help me down the line. And that's the way to think about it, right? So we have to, we have to be self-aware where we are what we are capable of. I always say I want to talk to people whose ratio ambition divided by skills is 0.95 to 1.05.
That's a beautiful.
See what I'm saying, right?
Yeah, that's
If
a
you have
beautiful.
a lot of ambition, no skills, or if you have no ambition, lot of skills, both are somewhat not good ratio. So if your ratio, then you are a balanced person. Then you will be pleasure to be around, and you know. So that's how we have to figure out. This is an individual thing. It comes with age, and you know. So
That's a good way to wrap this up. I think that AI presents some extraordinary opportunities and will also probably force us to examine what
yes,
you said, both our ethics and our sense of purpose and our sense of meaning in the world. So potentially it could be an extraordinary experience, and that's
yeah,
that's certainly
with
what I'm.
the AI or without AI, I feel fortunate that I'm an educator. And I always say every day I work, I'm either teaching somebody or I am mentoring them. I'm helping them to build their careers, people very young. When I first started, my first PhD student was only 2 years younger than me.
Wow.
And then I had PhD students who were 10 years older than me. And, you know, now I'm 70 and then I get students 22, 23. They're like little kids, you know, so I'm very patient with them and, you know, try to get them to do stuff and get them jobs. And we have joint meeting dinners and lunches and so forth. After spending 5 years with a PhD student, all I look forward to is the person graduating, getting a job, and then take the entire group for lunch.
That's awesome.
So I say that's what I like. Yeah. So I think we have
This
to
is
at peace with what we are, where we are, what we have done, so we can be happy. Thank you so much for this lively conversation. I really enjoyed it very much, and have a great evening and rest of the week.
Yeah, you've been very gracious to kind of go into that, and I really appreciate you taking the time. I think our listeners are really going to enjoy this. I think you brought up some very pertinent points in regards to AI, its potential positive outcomes, and also demystifying the separation between maybe human projection versus what AI is, and recognize let's put the focus and the awareness on both the positive and negative aspects of humanity, as opposed to handing the ball off to AI and saying it is the problem. The problem is just it has been the same problem that humans have dealt with throughout time. And from my our conversation, it would seem that you're very confident that we're going to navigate this one in the future. And
We are humans are intelligent.
I really appreciate that, and hopefully we've alleviated some of the concerns, and we've invited some more discussions amongst our listeners. I'm Wade-T. Lightheart from Bioptimizers. It's the Awesome Health Podcast. If you like this, share it. If you have some comments, some questions, or some challenges, I would love to hear them as well. This is a topic that we are going to revisit over and over in the coming age, because it is something that has the potential to shift humanity on a massive scale. And I anticipate, hopefully, maybe we'll even get you back in the future to kind of see where we are in a few years and what happens, because the rise of this technology is predominant. It's on the conversation of everybody. Virtually anybody now has the power to interact with it. It's not inside of these institutions where people maybe have thought these things out much longer. You've had 40 years to think this out. I've had, 40 months to think it out. So here we are. Thanks for joining us, everybody. Appreciate it. And we'll see you on the next podcast.
Thank you.
And now for a Bioptimizer's fixed digestion tip: how to get away with eating sugar. Hey, look, sugar is normally one of the worst things for you. But let's be honest. I mean, we all cheat from time to time. And here's a little trick that will ensure your body benefits from the sugar. Now, before you eat or drink anything sweet, take 5 to 8 capsules of P3OM. The patented strain in the formula devours sugar so fast it literally doubles in the body every 20 minutes in the presence of sugar. That doesn't mean that you can or you should eat a bunch of sugar or sit around all day doing that. But on the days that you do cheat, or you go after one of those maybe meals that you wouldn't normally do, This ensures that you get something in your gut that eats the sugar. And it's not going to feed the bad guys or spike your blood glucose nearly as much. So to learn more about P3OM and its sugar-devouring and protein-digesting properties and how it can transform your gut and metabolism, go to www.bioptimizers.com.
Thank you for listening to the Bioptimizers Awesome Health Podcast. You can find more information at bioptimizers.com.